Hey everyone, and welcome back to the Three Koi Fishes channel. We're a team of experienced moms and dads with over 80 years of combined parenting experience. Our mission is to cut through the noise and provide clear, practical advice to help you navigate your parenting journey with confidence. Today, we're tackling a topic that often brings a surprising amount of anxiety to new parents: umbilical cord care. You know, that little stump on your newborn's belly button? It might seem small, but it's a huge source of "am I doing this right?" questions. We're going to demystify it all, from the basic, why it's there, to crucial do's and don'ts, and most importantly, those red flags that mean it's time to call the doctor immediately. This is truly what every new parent must know. You absolutely won't want to miss our "when to worry" section later in this video. All right, let's dive into the main video. So, you've just welcomed your beautiful baby and suddenly you're looking at this little piece of, well, stump on their belly button. And maybe, like I did with my first, you're wondering, what even is this thing and how do I take care of it without messing it up? Let's start with the basics. That umbilical cord stump? It's the little leftover piece of what was once your baby's lifeline to you during pregnancy. It brought all those essential nutrients and oxygen. Once your baby is born, they don't need it anymore. So your healthcare professional clamps and cuts it shortly after birth. And voila, you're left with this little stump that needs to dry up and fall off on its own. Typically, this stump falls off anywhere from 1 to 3 weeks after birth. It's a natural process, just like how a scab heals and falls off. Our job as parents during this time is to treat it gently and help it dry out. First up, let's talk about the do's. These are the simple, effective things you can do to promote healthy healing. And a big thank you to the Mayo Clinic staff for providing clear, evidence-based guidelines that we rely on heavily and will link in our description box for you. The number one rule? Keep the stump dry. Air is your best friend here. To help it dry out, always keep the front of your baby's diaper folded down. This ensures the stump is exposed to air, not covered and getting damp. If your diaper brand doesn't have a specific cutout, you can easily just fold it down. Or, for an extra secure fit, you can even snip a small piece off the top of the diaper and use a bit of tape to seal the edge, keeping that crucial area free. Ever found yourself wondering about those little fluids around the stump? Is that normal? It's totally normal to see a bit of clear or even blood-tinged fluid seeping out around the stump. Don't panic. If you notice any, grab a wet cotton swab and gently clean them off. You might need to gently push down on the skin around the cord stump to get to all the fluids, or even slightly bend the cord stump for better access. Just be gentle. Once clean, pat the area dry with a clean cloth and again, expose that cord stump to air. Now, let's talk baths. For umbilical cord care, we recommend sticking with sponge baths. Why? Because it makes it so much easier to keep the stump dry. A sponge bath is essentially wiping or dabbing areas that need cleaning with a warm, damp sponge or cloth. You can use a bit of baby wash if you like, then rinse and pat dry. If the stump accidentally gets a little wet during a sponge bath, it's absolutely okay. There's no harm in it, just make sure to pat it dry afterwards. And this is a big one. A huge, do not pull the stump off yourself. I know it can be tempting if it's just hanging by a thread, but resist the urge. Let it fall off naturally. Pulling it could lead to bleeding or even infection, and we definitely want to avoid that. Now let's switch gears to the don'ts. These are some common misconceptions or practices we used to do, but expert advice has evolved. In the past, many parents were told to swab the stump with rubbing alcohol. But guess what? Modern pediatric guidelines, including those from the American Academy of Pediatrics, AAP, advise against this. Unless your healthcare professional specifically tells you to, do not use rubbing alcohol on the stump. It can actually irritate the skin and delay the drying process. Another don't we touched on earlier, but is worth repeating. Don't cover the stump with the diaper. It traps moisture, and moisture is the enemy of a drying stump. So, always fold that diaper down. Okay, this next section is perhaps the most crucial part of this video. We're going to talk about red flags. It's normal for the stump to change color as it dries, and even to see a tiny bit of blood. Think of it like a scab. Sometimes a little blood can happen if it gets snagged or rubbed. But there are specific signs that mean you need to pick up the phone and call your baby's healthcare professional right away. Prompt treatment is key here to prevent any infection from spreading. Let's go through these together. You might even want to screenshot these points. First, bleeding that gets worse, or if you still notice a few drops of blood after 3 days. A tiny bit is okay, but continuous or increasing bleeding is a red flag. Second, the umbilical area oozes thick fluid, especially if it's yellow. This is called pus. This is a clear sign of infection. Third, the area becomes red or red-streaked. This can be harder to see on darker skin tones, so remember to feel the skin. Infected skin often feels noticeably warmer than the surrounding skin. Fourth, the area is tender, swollen, or foul-smelling. Any bad odor is a definite concern. Fifth, your baby gets a fever, becomes very tired or irritable, or feeds poorly. These are general signs of illness that, when combined with any cord issues, warrant immediate attention. If you observe any of these red flags, please don't hesitate. Call your baby's healthcare professional right away. It's always better to be safe and get it checked out. One more thing, what if the stump just isn't falling off? If the stump still hasn't fallen off after 3 weeks, it's also a good idea to talk to your baby's healthcare professional. While often it's just taking its sweet time, sometimes it could indicate a minor issue or, rarely, something like an infection or an immune system condition that needs checking out. Has anyone experienced any of these red flags with their baby's umbilical cord? Share your experience in the comments below. Your insights could help another new parent feel less alone. And if you found these tips helpful, give this video a thumbs up and please remember to hit the subscribe button. Thanks for watching and see you in the next video.